Hi, my name is Mr. Roy Salazar. I'm one of the instructors for our nursing department at Healthcare Career College. Just because of the present condition that we are in, especially as a school, we decided to come up with this instructional video to just discuss some of the more important things. One of the things we want to discuss is the spread of coronavirus. One, we got to know what it is. When you're speaking specifically about the word coronavirus as a term, one, this is not a new virus. It's not something new on this planet. It's not something new to this country. It simply means that if I did put this virus under a microscope, it will show up where you have the actual nucleus that has crown-like spikes as it grows. And there's different kind of coronaviruses. The coronavirus had been detected because of multiple deaths of animals and poultry since the 1930s. However, very commonly, most coronaviruses, because they originated from animals, they get to infect animals. The new coronaviruses that we have, the ones that we call zoonotic in nature, meaning now they're able to transfer from animals to people. If you look at the source of even SARS or even the new coronavirus, the COVID-19, they call it novel coronavirus. It's now because we can see how it gets transferred from animal to human. If you look at Wuhan, one of the places that's credited to it, it's a wet market where livestock or poultry is sold and also butchered, where all the excrements, fluids come down, and the people who butchers them, who sells them, also gets in contact with it sometimes. They actually call this a novel coronavirus. When we designate the word novel with a virus, that means one, that it's something that we have not seen before as a virus, or a version, a mutation of the present virus that we know that have not mutated to this type. So when we call coronavirus, it's not something new, but we call this novel because it's a new strain. With most viruses, if anybody had experienced having a cold, that's a virus. And when you talk about the spread of coronavirus, it's almost not any different than that. One of the things we're talking about, respiratory droplets. So by respiratory droplets, you could actually get respiratory droplets out of your body by sneezing, by coughing. And at the same time, if you cough on another person's body part, if you cough at an object that another person actually touches, that's how it is spread. Coronavirus itself is not really considered airborne. It's not stay up during the air, cannot be transferred like that. But however, the respiratory droplet that exits your body, if somebody sneezes or coughs, I suggest you don't walk directly at that path even a few seconds after. Some of those droplets linger up in the air for a while, and some of them go down right away, but it's safe not to cross their path. And at the same time, if it's spread by respiratory droplets, if you ever sneeze in your hand, which I suggest not to, you should be washing your hands at least 20 seconds with soap and water. If you don't have that, an antimicrobial, which is in short supply right now. If somebody you know sneezes a lot, coughs a lot, and touches other objects, that is a way of transmitting it unless that object is sanitized or washed. So one way of not spreading it is not touching and not coming in contact with anyone, body parts, or any inanimate object that was in contact with those respiratory droplets. Well, the body gets affected first as most common things is cold and flu-like symptoms. When you have cold and flu-like symptoms, which everybody already had, first you do feel feverish, except this is a higher grade fever and sometimes a rapid onset. You have coughing. Except one thing that defines coronavirus, sometimes it's not even a productive cough. You're not spewing a flame or anything, but sometimes it's a dry cough. But what really identifies it, once the virus enters the body, coronaviruses, the spikes I'm talking about, depending on the affinity, there's different types of them. Some have the affinity of the spikes to just stick to your nostrils, to the cells of your nostrils. Some have the affinity to actually, the spikes, to cling on to the cells of your lungs. And that's what's bad. When they multiply in your lungs after the second, third, fourth day, that's when some of the heavier manifestation shows up. So a lot of the things they've talked about, some people that they've tested, that they've gotten as patients, is shortness of breath. So although we're alarmed with having a little fever, kind of cold and flu-like symptoms, what alarms us the most is that shortness of breath. When it had already affected your ability for gas exchange, which is the primary function of your lung tissues, to do gas exchange. A regular cold or flu-like symptom that does not make you short of breath. So it affects the body in the point that it impairs your ability for good gas exchange. Well, some of the concerns really, it may have not been addressed, is that what if this develops to another strain? Would we be ready for it? That's a problem that other people would have to solve, that we try not to contribute to. But how it is right now, in the present, it's called COVID-19. It's called novel. But the biggest thing we can do is whatever form it is right now to prevent transmission. Like I said, through respiratory droplets, one, have a very good respiratory etiquette. It's a term we use in nursing or in the healthcare industry, that if you were gonna cough, you will try not to cough directly at another person, sneeze directly or indirectly at another person. And if you did cough, you're going to try to cover your mouth or your nose when you sneeze with a tissue. And you will get rid of that tissue paper and still wash your hands, if you can, for at least 20 seconds with soap and water, preferably an antimicrobial soap if you have it. But if just in case you actually sneeze on any kind of objects, like a surface, well, clean that too, the same way with soap or anything of a sanitizing agent. But the thing is, if we don't do this, any person who touches it would most likely get the virus too. It's been proven that, according to research, that sometimes it could stay several hours on stainless steel surfaces, on smooth surfaces. So one of the things I would do in the school is, unless you really have to touch any surface you're not familiar with, commonly touched surfaces, I wouldn't touch it. Unless I have to be in close proximity with people, in a very enclosed space, like a cruise ship where you can't go anywhere else, like an enclosed place where there's just non-circulating air, I probably would prevent those. But the biggest thing is, whatever you touch, try to make sure that you clean it so that when other people touch it and you're sick, they do not pick up the virus. One thing I'd like to do is some of the misconception. What I have right here are two kinds of masks. These are procedure masks called surgical masks. You usually see this as healthcare workers, and you see people walking around this. Against the coronavirus, this is supposed to prevent either you from getting what you have out or from outside going back to you, depending on how you wear this. When you wear this, these are surgical masks. It's not that helpful really if somebody sneezes at you, if they sneeze from the side, because they'll remain open. The next thing that's really we have to use, that us healthcare workers have to use, is this N95 mask. We have a better version with this, where you have a vent so it doesn't fog up. But these N95 masks are supposed to be fitted to us when we go to a facility, that you have your actual size that's fitted, that it comes with full enclosure. All this mask does not prevent you from contracting the virus if you don't wash your hands, if you don't protect your hands. This makes it feel better sometimes that we have it. But if everybody buys this N95 mask, even commercially, the personnel like us, healthcare personnel who has to take care of the really sick people in a facility, in a hospital, if we run out of this equipment, this N95 mask, it makes us less effective and puts us at a greater risk, because we're the ones who will be facing the bigger risk multiple times a day compared to somebody at home. If you find out that you're sick, if you look at CDC, Central for Disease Control, and World Health Organization, one of the most simplest things they ask, if once you see the signs and symptoms, is if you can initiate your self-quarantine 7 to 14 days. And if you really are just feeling sickly with cold and flu-like symptoms, if you can quarantine at home, make sure you eat good nutritious food, alleviate the pain of body pains, fever with regular analgesics or antipyretics. But if you do feel that you have to go to an emergency room because now you have this shortness of breath, inform the emergency room before you go in that you are experiencing the symptoms. If you traveled out of the country, especially the countries we identified like China, Italy, France, let them know before you come in. But do not panic. As students right here, we'd like to maintain a very healthy environment. I do watch for my students if somebody was coughing several times a day, if they're developing a fever, because we want to prevent this. But in closing, if we panic, we sometimes destroy our environment, our hope for the future, not because of the virus, but because of what we do to our community.